Well, good morning. It is October 19th, 2020, and I want to thank everyone for being on the call again this morning. This is Monday during open enrollment for Medicare and soon to be ACA on November 1st, so I know this is a crazy time of year, so I appreciate everyone taking some time this morning to be on the call. And again, these calls are for updates for you, so as we get new information throughout AEP, this is the best way keep up to date on what's going on out there, and so you can make informed and smart decisions on how you're helping your clients. But as a reminder, we are recording these calls and they are available on YouTube. So the reason I'm saying that is because I know some of you that normally are on the call may have appointments on Monday morning, and I can already hear you guys driving from place to place. So as that's happening, just don't force yourself, be safe, and know that these calls are being recorded for you, and you can access them at your leisure on our YouTube channel. Just type in Health Plan Markets, and you should be able to find us there. So with that, we've got some training this week. It's a little bit lighter this week, so not too much going on out there. But this morning at 11, AdventHealth is doing their broker coffee talk, and they're doing that weekly. Again, you can register or jump on the call at 11 o'clock this morning, and they're going to have some information on all things Devoted. So, no matter what market you're in, if you're interested in learning about Devoted or getting help from Devoted, 11 o'clock is when they're going to do that today. On the 20th, tomorrow at 9 a.m., Health Sherpa is hosting a training. If you're doing ACA products, individual and family plan products, on the marketplace, Health Sherpa is what you need to be using for the platform, and that training is available tomorrow at 9 o'clock. United Healthcare is hosting a coffee and talk chat session with both Al and Deb. That's tomorrow at 9 o'clock as well. Tomorrow at 10 o'clock, Bright Health is doing their first round of individual and family plan training, so those ACA products on marketplace trainings. There's going to be one at 10 o'clock tomorrow and another session at 1 p.m. tomorrow. Moving on to Wednesday, the 21st, United Healthcare is doing their Lean Electronic Signature training, and that is at 11 o'clock on Wednesday. And then at 2 o'clock, Humana is doing their telephonic enrollment and electronic signature training on Wednesday at 2 o'clock. And just remember, guys, these electronic training classes are really going to make you very, very efficient during AEP. And those of you that have embraced technology, this could be your best AEP ever, just because you're saving tons of windshield time, not driving from appointment to appointment. So just think about that as you're learning these tools out there. And then on Thursday at 10 o'clock, you've got Bright Health again doing an individual and family plan training. That one's in Spanish, so if you prefer the training in Espanol, that's at Thursday at 10 a.m. You can get that training done. Also at the same time, CarePlus is doing their virtual enrollment tool session, so you can learn how to use their enrollment tools that are available now. And Thursday at 11:30, Devoted is doing another broker coffee and chat session. That is in the Jacksonville market. However, as I said before, if you have any questions regarding Devoted, especially if it's global, those trainings are awesome to go to because you get one-on-one frequently asked questions taken care of. And then Thursday at 1 o'clock, you've got Bright Health, individual and family plans. That's at 1 o'clock. Again, training for ACA, products for Bright Health. And then last training of the week on Thursday, Humana is doing their Marketing and Resource Center and Facebook advertising training. Many of you have been asking over and over and over for these Facebook trainings. It seems like people are getting leads and sales off of Facebook, so there is a mandatory class that you need to take in order to access the Humana Facebook advertising pieces that you can use on Facebook. And they're pre-approved. You can load them up there and get leads that way. And that, again, that's on Thursday at 1 o'clock. So if you're looking to expand your reach and grow your book of business using Facebook and Humana's Marketing Resource Center, Thursday at 1 is the training you need to be at. That's the trainings for the week. Nothing on Friday this week. So, you know, keep it light and simple as far as what's going on out there. I know many of you are very busy seeing clients. Now, with that said, I want to remind everyone that most of the 2021 Summary of Benefits and Carrier data is now in our Gold Key. And if you don't know what our Gold Key is, got to get with it. I'll post a link here on the video so you guys can access that Gold Key video, but it is on our YouTube channel. You can go out there and learn what our Gold Key is. But just in a nutshell here, basically we've taken all the PDFs and spreadsheets and videos and slideshows, and we put it all in one place for all the carriers. So you have access to that on your laptop, your phone, and your iPad. So if you're in the field, you can do a complete presentation on your iPad just by jumping into a carrier. So if you're in front of a client and they're interested in WellCare, you can show them the WellCare sales video. You can go through the summary of benefits, and then you can jump over to Ascend and do the electronic enrollment, all while not having to pick up the kit. Now, as a reminder, although we have all these digital tools and digital resources in our Gold Key, please remember you are required to leave a physical kit behind at your appointment, or if you're doing it remotely, it is your responsibility to send them a kit. So you need to make sure that each of your clients do have a physical kit after your presentation. So make sure that you get that to them so they have it available. But I want to thank John and Tom and the team for putting that Gold Key together and keeping that up to date for 2021. So right now we have 2 folders, and it might seem a little overwhelming, but on the Medicare side you're going to have a year 2020 and then year 2021. So please make sure you're paying attention on which folder you're in. I know some of you have started to turn in paper applications, and we understand, sometimes that's necessary, but we're finding that most of the enrollment errors already the first week of open enrollment are coming from paper applications. You guys are, I know you're in a rush, but you got to slow down, take it easy, and go through that. But when and if possible, please use those electronic apps, because you're not going to miss, a phone number digit or miss clicking a box on the paper app. You can do that on the electronic app, and it keeps you in line. So that's why we've been a big proponent for electronic apps, because we are seeing a lot of errors already in the first week of open enrollment. So if you are using paper, slow down, review your app 2-3 times, and get somebody else's eyes on it. I will remind you that you can turn in the applications at our office. We'll process it for you, fax it to where it needs to go, and we'll take care of all that for you. And one of the reasons you want to do that is because we do scrub the applications. Both Cindy and Jessica help us with that at the office, so you can drop off your paper applications if you have some, and we'll scrub it and send it off and make those corrections when necessary, just to keep some extra eyes on it. But we do recommend using those electronic apps just because it's going to save you a lot of headache, but also for your purposes, every electronic application for January 1st effective, you have a $5 Amazon card waiting for you. So if you have 100 apps for AEP, I've got a $500 Amazon gift card for you. They're all electronic. So just a little spiff for you, just to keep the idea for electronic. It's just going to be a lot easier. Plus, your members are going to get their enrollment information jump-started at least 3 to 5 days faster than a paper application, and you get paid faster, because a lot of these carriers are going to be paying the first week of January, and those applications that are processed first are first up. So if there's any issues with paper applications, they usually go to the back of the line versus those electronic apps. So you get paid faster. It's really nice, especially this time of year for your 11 ones and 12 ones. You're going to be able to get those paid faster. All right, some news with network. United Healthcare has announced that for most of their HMO products and most of their PPO products, they are now moving to a national network. So what does this mean for United Healthcare? Basically, if one of your members is living here in Florida and then moves out to, let's say, New York, and wants to access a doctor in New York, they should be able to access the same network as if they were here in Florida. So that's not the case for all HMOs and all PPOs. It is on most of them, but they're moving in that direction because it is a phenomenal network that they have with United Healthcare, and expanding that and not segregating that by regions is really going to make them a contender moving into 2021. So just keep that in mind when you're out there offering products to maybe people that are actually, possibly spending most of their time here in Florida, maybe traveling a bit. United Healthcare is a good solution for them versus putting them on a supplement plan, which can be a lot more expensive monthly. So keep that in mind. You all got an email about details on that. Again, Al and Deb are going to be available tomorrow morning at 9 if you have more questions about their national network. Just a great move in the right direction, in my opinion, especially for those clients that travel quite a bit. Here locally in Orlando, Orlando Family Physicians has been announced as the newest provider group to join the CarePlus network. So CarePlus is now being accepted at Orlando Family Physicians, and that will expand their reach into the primary care sector in Orlando by adding that large MSO group. I think they have almost 20 facilities across the Central Florida area, and many, many doctors. Many years ago, they took CarePlus. For whatever reason, it didn't work out, and now they're back in the network, and it looks like they're going to be effective with them on November 1st. So as you open your CarePlus directories, if you bump into an Orlando Family Physician member and they're interested in CarePlus, they'll be able to join as early as November 1st. Remember, CarePlus is a 5-star plan, so you can put them in as early as 11/1 and not have to wait until January 1st effective. So just a little tip there for you guys that are selling in Central Florida. Devoted, also news in their network. Over the weekend, they were able to secure AdventHealth and the AdventHealth hospitals and some of their facilities. That will be going live on January 1st. So those of you that are writing Devoted Health in Central Florida or West Florida, pretty much the I-4 corridor, AdventHealth is going to be in the Devoted network as of January 1st. So that's big news. You really can't get around AdventHealth if you're going to do business in Central Florida, and it looks like they're the newest addition to the team there with Devoted. They should show up in the directory. I was told sometime this week, maybe even next week, you'll start to see some of those providers and hospital systems in their provider directory, so be on the lookout for them. Again, more information on their network, you can jump on the call at 11. Devoted Coffee Talk can answer any questions you may have on that. Cigna now has a broker telephonic enrollment option. So if you are presenting to one of your members over the phone and they're ready to enroll, maybe they don't have an email address and you can't wait to mail them a kit, you can get Cigna on the line and do that broker telephonic enrollment situation happening and get them switched over right over the phone, and you get full credit for it. So, one thing I will tell you is one of the reasons why we ask you to report your sales is so we can track your sales and help you keep that organized just in case something happens. And for that instance, Cigna has also announced that they are protecting agent of record for Cigna members that are switching plans. So if they're moving from a core plan to a D-SNP or an HMO to PPO or whatnot, Cigna has now sent out an email saying that they will protect you as the original agent of record if the member calls into Cigna and makes that switch. Regardless, we're seeing a lot of crosswalk plans. We're seeing some crosswalks with Humana. We're seeing crosswalks with United Healthcare. And these crosswalks, basically, they're either consolidating plans by, eliminating some of those options and putting them all into one plan, or we're seeing crosswalks where they're actually terming a plan and moving all those members over into the new plan design. In either situation, I know many of you veterans have been very nervous about doing or trusting the plans to do crosswalks, and I understand that completely because there has been situations in the past. However, please make sure that you're keeping track of your book of business. Take a snapshot of what it looks like today And then on January, you'll be able to take another snapshot and really take a look and see, what does your book of business look like at that point as well, making sure that all of your members have stayed put and they're still on the right plan. And if they're not on the right plan, we need to have an email put together. And based on your report, after you've done those submitted applications, we have all the information necessary so we don't have to pull you out of the field and ask a million questions. You can just grab that data from our CRM system and send it over to the plan to ensure that we've got them on your book of business. So just a little help from HPM to make sure that you're getting paid. However, these plans are already starting these crosswalks, so there really isn't much that you need to do on these crosswalks. Just pay attention and make sure that you know which crosswalk plans are happening for your members in case they call and get a letter or a phone call stating that, this is what's happening, and they'll be moved over to the new plan design. Because you will get phone calls, most likely from those active members that are really paying attention. But just keep in mind that that is happening. You've been getting several emails regarding these crosswalks from the plans, and I'm just mentioning them to you now just to ensure that you know what's happening out there. Protect your book of business. This is what you guys do. This is your livelihood. It's your meat and potatoes. This is how you make your money. So just watch that as far as your book of business. Another update, Bright Health, they have new kits that are coming down. You'll notice that there were a few errors. So they sent out an email last week. The old green books, you'll see the green Bright Health books, those have several errors in those, so those are being replaced with an orange book that's coming down the pipe. So they're moving from the green books to the orange books. So those agents that have the green books, as soon as those orange books come in, please, destroy the green books. Those are out of date. They have several errors in those, so you don't want to mess that up. We should be getting a shipment of orange books very shortly. So either Kim or Cindy or someone from HPM will give you a call. If you're active and certified with Bright Health Medicare, we'll give you a call and let you know that those new orange books are in, so you can pop in the office and pick those up. So we have those available. Okay, so those are coming down the pipe. All right, Humana sent out an email last week about free masks. They're giving you guys, I think, up to 50 masks that you can use for your clients, for your marketing, for your tabletops, or whatever you're doing. You can order those for absolutely free. You'll have to go through the proper channel there. I believe it's in your MRC portal. But you did get an email on that, so just check your Humana emails for more details. But it's a reminder, guys, we're going into flu season here, and, if you're into that, now's a great time to get your flu shot, especially with all the things that are going on, So, protect yourself, protect your family. If you believe in those flu shots and you want to get those flu shots done, this is the time to do it. I know some of you have medical conditions where you can't do that, but consider that flu shot to protect yourself coming up in the flu shot season. So take care of that. All right, a little bit of ACA here. I want to remind everyone that Big Wave is available for on-demand leads, and you do have to sign up for that. So if you're offering individual and family plans on the marketplace through the Affordable Care Act, you have to sign up for on-demand, or what they call Big Wave, the Big Wave system. You have to sign up for that. So people in your zip code or in your general area that are requesting information on individual and family plans, they can do so by clicking in there and saying, I'm requesting information from a live agent, and you'll have about 15 minutes to respond, and you have a lead. So those agents that are using On Demand, I have seen their sales really improve by being available on demand through the marketplace. So depending on where you live and your area, you may get a shot at some of those leads based on your zip code and where you reside or where you're posting up. So just another lead source I wanted to share with you guys so you don't forget that. Moving into Medicare, I want to also remind you that Medicare has an account. So as you're meeting with your clients, talking with your clients, at this point, if I was out there doing enrollments, I would sign each one of my clients up for a Medicare account. And here's why. Number one, it keeps all their medical information, their health insurance information in one place. They can access any type of billing. They can see, what doctors are billing Medicare. They can see the providers. They can see what plan they're on. And for you, you can actually see what plan they're on and if they're receiving any additional help through either Medicaid or LIS. And also important is some of these systems now, like Ascend, have a blue button feature. So if your member has an account on Medicare and you click that blue button, it actually downloads all the members' prescription drug information that they can keep in their account. And it also pulls their providers so you don't have to go searching for all of that. So it's a really, really great tool, but it's only available for those members that have a Medicare account. Remember, you have a CRM system available, and you can keep that login information for your clients and keep that up to date in your records. And just make sure you have permission from your client to save that data and ensure that they're okay with you going in there and pulling that information when they need you to. But this would be extremely helpful for those members that maybe made a boo-boo or are carrying around 3 or 4 or 5 health insurance cards. We've run into that in the past. They don't know where they're at. They don't know what doctor they're going to, what plan they're on, what extra help they're getting. And when you get there, you'll be able to jump in there, start an account, and see exactly where they're at without having to sit on the 800 line and waiting for someone, in Kentucky or wherever they're at to answer the phone. So, so there you go. Medicare account for your clients. Set those up as you see your clients, and that'll really help them stay organized. And they'll have access 24/7. So if they have any questions about their Medicare account, they can go in there. But just as a reminder, Medicare.gov is the only official way that you are allowed to compare plans. Now, I know Tom and the team at HPM have put together a couple of spreadsheets to help you understand what's out there and to spreadsheet the plans so you can see a side-by-side comparison. But keep in mind that that is for agent use only. That is for your eyes only. You are not to share that with clients. That is not an official marketing piece. It's not compliant. You're not allowed to do it. So the only place that you can compare side-by-side plans is at Medicare.gov. So I believe you can compare up to 3 plans at once. So you would go in there, type in the zip code for your member where they're at, and you just pick up to 3 plans, and you can do a side-by-side comparison on Medicare.gov. If they have a Medicare account, it will pull their medications and their doctors and put them in order on which plan may be the best fit for them for 2021. So mess around with that Medicare.gov. If you haven't, it's a fantastic tool. I think they did a great job reinventing that website and ensuring that it is up to date and working well. I did also see an article that the cost of living adjustment for 2021 is going up to 1.3%. What does that mean is that most of the seniors are going to get a 1.3% raise in their Social Security. What does that mean? Well, if you had any members that were on the edge of LIS or Medicaid, or maybe they were now making more money per year and they'll have to pay more for their Part B premium, these adjustments, when more money comes in, sometimes more money comes out. So just keep in mind that that cost of living adjustment, the COLA rate, is going up to 1.3% for 2021. So just a little thought for you guys as you're out there in case there's any changes that are happening in January. They should start to see that go into effect in January on their Social Security checks. And that's pretty much it for me. Just as a reminder, if you're in Central Florida, especially Seminole County, early voting has started today. So don't be shy. Get out there and vote. We are lucky to be in a country that allows us to vote. And I know that this is a big, big election, for the primaries, but even for your local leadership in your counties, be a voice, go out there, be heard, and go vote. So with that, boy, that was a lot. I hope I didn't bore everyone to death. I know a lot of you have questions, so I'm going to go ahead and open it.
Justin, this is Kim.
Yes. Hey, Kim.
Hi. As far as Bright Health kits are concerned, the new orange kits are all in for all the counties.
Fantastic. So thank you, Kim. So any of the, if you're out there and you're holding on to Bright Health, if they are green, you have a green book, please destroy those green books and come on in and get those orange books. They have been replaced. We don't want any errors happening, so don't feel guilty about it. Just come on in. We've got a dumpster at our office. We'll be glad to help you out with that. Thank you, Kim.
Hey, Justin.
Good morning.
Justin. Good morning. Regarding the question regarding UnitedHealth, if you have people that are down here and they're the national plan that UnitedHealth is going to implement.
Right.
If you have people that are going to, let's say, for instance, you put them down here and they move to another state, we need to rewrite them in that state?
That's correct. So if you have a member that physically moves out of the area, especially in your situation if they move to another state, you do have to be licensed, certified, and appointed in that state in order to rewrite them. Okay? So let's say if they move to Connecticut, you've got to be licensed, certified, and appointed in Connecticut for the plan that you're going to be writing them on. So in that situation, if they're on United in Florida and they move up there, you have to be licensed in Connecticut, certified and appointed with United Healthcare in Connecticut. Okay. And just keep in mind that you've got to do a full presentation all over again. You can do it remotely. You know, that's no problem there. I've done that in the past. And then send them a kit, and you can do that through your portal, specifically.
Okay. Okay.
Yep, that's a great question.
Okay. Yeah, because I have a couple that I got them with plans, looking at moving to another state, and the only a couple of plans up in that state, and one of them is United.
Yeah, so one thing to keep in mind, too, is if a member moves, remember that they're officially moved when they notify Social Security.
I have taken Uber.
Yeah.
A lot.
So,
Yep.
So if they're moving to Connecticut, for instance, and and they moved there last month, but they haven't notified Social Security, the moment that they notify Social Security, they have a 60-day window open to enroll in a new plan, right?
Yeah.
So it's whenever they notify Social Security of their move is when that countdown starts. So sometimes it happens a little bit later, right? But that's the official way of doing that.
Okay, thank you.
You got it. All right. Any other questions this morning? All right. Well, I appreciate everyone for being on the call this morning. We're going to do it at the same time, same station next week. And as a reminder, we are recording these calls just in case you're out in the field and you're talking to somebody or you're having appointments out there. I know that happens. So, you know, make sure you're subscribed to our YouTube channel and you have your notifications on. As I post these, I'm going to upload this video, and those that missed the call this morning will get a notification. So I want to thank you, and good luck out there. Any questions, we're here for you, 844-696-3975. Thank you, guys. Have a fantastic week. Good luck out there.